Did you ever stop to think about what those mosquitoes can do to your furry four-legged friend? Heartworm disease is the #1 canine disease that's transmitted through mosquitoes. It can be very fatal to the dogs if left untreated or unprevented. Hi, I'm Stephanie DeCouse, and I've worked in the Hudson Veterinary Clinic for over 4 years now. I've seen my fair share of heartworm-positive dogs over the years. Some have made full recoveries, others, however, have had too severe forms of the disease in order to recover. Let's take a look at what heartworm disease is. Obviously, by now you've learned that heartworm disease is transmitted through mosquitoes. When a heartworm-positive mosquito bites a dog, the larva from the heartworm is transferred into the dog's bloodstream. The larva, 6 months later, then will have matured into worms that live in the heart and lungs of the dog. If left untreated, those worms can multiply, and there can be as many as 30 worms in a heartworm-positive dog's heart. And they can live in there for up to 7 years. When a heartworm-positive dog is outside and gets bitten by another mosquito, that mosquito then picks up the heartworm disease. That's how heartworm disease is transferred from dog to dog. And it's just a vicious cycle that keeps going. Oh, I have slide. What? Test. Okay, my slide's not working, but I'm gonna keep going. So heartworm disease, since heartworm is transferred through mosquitoes, heartworm disease is a lot more common in swampy areas, and I would have had a map to show you that kind of more south towards Florida, there's a lot more cases diagnosed each year. In Iowa, we have 5 to 26 cases diagnosed per clinic per year. So that's according to the American Heartworm Society. Now that you've learned what heartworms are and where they occur, I'm going to explain to you about how to test for heartworms in your dogs. Heartworms can be tested 2 different ways, either through a blood test or through an x-ray. The blood tests are, there's also 2 different types. The first type is testing for antigens in the blood. Antigens are proteins that are harmful to the body that are excreted by the female heartworm larva. And the other test is an antibody test, which is better to detect the disease because it can detect not only male and female larvae, but juvenile and adult ones as well. And that test for what the body produces to kind of ward off the antigens. The x-ray is more commonly used, an x-ray or ultrasound is more commonly used in telling the severity of the disease. If you have a heartworm-positive dog, it could be just like 1 or 2 worms in the heart, or it could be up to 30. So they use the x-rays to kind of tell the severity of the disease. I did have a picture of an x-ray with the worms in the heart. So if your dog is diagnosed with heartworm disease, it is treatable. The treatment for heartworm disease is basically a controlled poisoning of the dog. The treatment for it is an omidicide that is injected into the spinal cord of the back of the dog, and it's a series of 2 injections, and it's 24 hours apart, 1 on each side of the spinal column. And that, during the treatment of heartworm disease, you have to keep the dog very calm, cage rest, because all of these dead worms are flowing out of the heart, and so if the dog is really active, this could cause like heart failure with all the worms trying to escape the heart at once. So, in most cases, heartworm disease, the dogs show no signs or symptoms of the disease. In really rare cases, when the disease is very severe, then you'll get some coughing, and they'll be kind of lethargic, and you'll start to find other symptoms, but they wouldn't necessarily make you wonder about heartworm disease right away. So that's why it's important to use preventatives. There are a variety of preventatives out there for heartworm disease, including like HeartGuard Frontline or HeartGuard Sentinel, Advantage, and there's several different preventatives that you can use. They're as easy as giving your dog a treat once a month. The preventatives also range with the other protection in them. Some prevent for fleas as well as heartworms. Some prevent for other internal parasites. So you're actually getting a great deal preventing for heartworms, because it's preventing a lot of other things in your dog as well. So the next time that you decide to go for a walk in the woods with your dog, remember that heartworm disease is transferred through mosquitoes, and it can be very costly to treat and is hard to detect. So, in order to keep your dog safe, make sure your dog is on preventative. Thank you. Are there any questions?
It's interesting that you've had so much experience from your vet clinic. Do you conduct some of the tests yourself, blood tests and the x-rays?
The question was, do I conduct some of the tests or do the x-rays? And at the clinic that I work at, I help hold the vein for the doctor to draw the blood, and then I actually am the one that runs the tests. The tests are really simple. Usually you just put some drops of blood on the little test strip and then put like a solution in with it, and it takes about 15 minutes and they know. So there's different forms. Like I said, our clinic uses the antigen test, and we have an antibody test that we use to double check if a dog is positive.
So if we've been using the preventive with our dog, do we need to have them tested in addition?
The question was, if you're using a preventative with your dog, do they need to be tested? At our clinic, we recommend testing dogs that are on heartworm preventative all year round, that they need to be tested every other year. If your dog is only on heartworm preventative during the summer and spring months when mosquitoes are out, then they need to be tested before you start heartworm preventative. So in like February or March, we have a lot of heartworm tests going on at our clinic. This is because if you start a heartworm preventative in a heartworm positive dog, the heartworm preventative basically does the same thing that the injections do for getting rid of the heartworms. So it will actually be fatal to your dog if you give them preventative and they do in fact have it.
I've noticed there's quite a range of preventive treatment items in their price. Can you shed any light on that? Like the vet might be pretty expensive, and then there's something at Fleet Farm that might be rather inexpensive and claims to be the same thing.
The question was, there's a big price difference in a lot of the preventatives. Can you shed some light on the differences between them? And actually, heartworm preventatives cannot legally be sold through like Tractor Supply, Farm and Fleet, or any pet store because of the risk of treating a positive dog. So you can only get those preventatives through a vet clinic. You can get flea preventatives like Frontline and stuff like that through those places, but they don't have any heartworm protection in them. The best thing to do is talk to your veterinarian and see what product they recommend for your dog, especially in the area of where you're living. Our vet clinic recommends using a combination of a couple products for the flea preventative and the heartworm preventative, and not going for the cheaper option and getting them all in one.
Has your experience do after choice?
The question was, what was the question?
Your experience at the vet clinic.
The question was, has my experience at the vet clinic led to a career choice? Yes, my I just graduated from Hudson High School in May, and in the fall I'll be attending the University of Wisconsin at Platteville to study animal science, and after getting my degree there, I will be applying for vet schools.
That's all my questions.
Why is it that treating a heart-positive dog would be fatal? Like, is that because of the worms in their heart and their exercise, like you talked about before?
The question was, why is treating a heartworm-positive dog fatal, or why can it be fatal? The reason is because when you give them either a preventative or the injection, it kills off all those worms. And so they're not going to be stuck living in the heart anymore. So they're going to try and go through your blood, or through the vessels in the heart, and they're all going to be trying to get out of there at once. So if your dog's really active and your heart's pumping really fast, that can cause almost like a heart attack in the dog. Are there any other questions? Yeah. The question was, how long does it take for the heartworm cycle to die off when being treated? It takes about 6 months. Like I said, you give the injections 24 hours apart, and then the vet clinic will probably come back 6 months later and retest the dog to make sure that they have gotten it all. Once a dog has been heartworm positive, you can't use the antigen test on them anymore because they have those proteins in their blood, so you can only use the other form of test on them. So after a dog is heartworm positive and has been treated for it, they have to remain on a heartworm preventative every single month for the rest of their life in order to prevent another infection. Any other questions?
Does your clinic recommend treating the dogs only in the summer or year-round for general dogs that haven't been already infected?
The question was, does my clinic recommend treating them just in the summer or year-round? In our clinic, we recommend for medium and small breed dogs that they just keep them on the preventative all year round. It's more cost-effective for the owner. As for large breed dog, it's kind of the owner's choice of whether they want to. It costs about the same to either test every spring and then put them on the heartworm preventative for the 6 months, or just keep them on it all year round. It's kind of owner's preference with a larger breed, but with a smaller breed, it's quite a bit cost effective to do year-round preventative. And that is just for Iowa, because in the south there's more cases and their season would be a lot longer, so they would have to be on heartworm preventative a lot longer. So usually, like when you're more south, it's more of a year-round thing, but that's for Iowa. We only do it during the summer. Any other questions? Thank you.